Hello, my name is Evelyn, and this video will provide an overview of the main functions needed to administer medications using the Omnicell automated dispensing cabinet. The main functions that will be reviewed include logging on, selecting and adding patients, removing medications, documenting waste, returning medications, and removing virtual kits. To log on to the system, there are two ways. The first is to use your username and password, and the second, biometric ID. If you are using your username and password, you will have to enter this information each time you log on. If you are using biometric ID, you only have to enter your username at the beginning of your day. You can then scan in, and for the remainder of the day, simply scan to get onto the system. You will need a super user in your area to enroll your fingerprints if you choose to use biometric ID. Once logged onto the system, you will need to select a patient to work with. To select your patients, work off of your local or global lists. The local list will show patients in your area, and the global list will show all the patients in your facility or hospital. To search the list, simply type in the name of the patient you're looking for. Use last name. If you are searching your lists and you do not find your patient on the local or the global list, then simply select Add New Patient to add that patient in. This profile that you create will be a temporary profile, but pharmacy will reconcile this profile with the patient's permanent profile. Just be sure to enter as much information as you can. Start with their last name, their first name, and their patient ID. All of these elements will be required. The patient ID is also the visit number, which is usually 13 digits long. If you cannot locate the visit number, please input a single digit to ensure that this field is complete. Once the patient is added into the system, they can be found on both the local and global lists. To remove medications for a patient, start by selecting a patient. Then select Remove Meds, and when you're on your stocked medication screen, type in the medication that you're looking for. Select the medication and input the intended dose. Then select OK. You can remove multiple medications at once by selecting other medications at this time. With narcotics, we have to enter the intended dose as well as the physician's name. You can select from a list or input the name yourself. Again, with our narcotics, we must input the dose, the name of the physician, and simply select OK. Once the medications have been selected, we can review our selection by hitting Display Meds to remove. And if you're ready to remove, simply hit Remove Now, and you'll be directed to a flashing drawer. Once directed to the drawer, open the drawer and locate the flashing light that indicates the bin in which the medication is kept. When removing medications, you'll need to open the bin. With narcotics, the screen will prompt you to count before you remove. You'll have to verify the count, so current bin level shows 5 vials. I will count to ensure I have 5. 1, 2, 3, 4, 5. Select Yes, and then remove my medication. Once you are done, you'll be directed to the next bin with another flashing light. Open the bin, and again with this narcotic, you'll be prompted to count, so there should be 5 in the bin. Select Yes if that's true, and remove the medication you need. Once you're done, close the drawer, and if there are other medications, you'll be directed to another drawer. Open the next drawer, And with this one, we'll see an open matrix system where all the bins are open. In these bins, always aim between the flashing lights and take the medication that you need. Once you're done, close the drawer, and if you're done, it'll take you back to the main screen. For narcotic medications, all unused portions and whole doses that are unused must be documented. We can document waste in the system, but we always need a witness. Any user who's able to administer narcotics can witness in the system. This would include nurses as well as physicians. To document a waste, simply select the patient, select waste meds, select the medication which you want to document waste for. Any partial doses will show up on the Meds Requiring Waste tab, and any full doses will be shown under the All Meds tab. If we are documenting a waste for hydromorphone partial dose, we can select hydromorphone. We see that the administration amount and waste amount are pre-populated. We must enter a reason. We can type or select from the list of reasons. Here we're using a partial dose. If we select OK, we'll be prompted to enter a witness ID. The witness will type in their name and password, or they can scan their fingerprint. Then you'll review the information to make sure it's correct and hit Record Waste Now. The waste will be documented. For the full dose of narcotic, select Waste, go to All Meds, and select the lorazepam. Here you'll see 1 milligram is given, but we can say none. The full dose is to be wasted. Enter the reason as perhaps prepped in error. Hit OK, and then the witness will enter their ID, again with their username and password. Review the information to ensure it's correct, and then hit Record Waste Now. Any medications that are unused, clean, whole, and in their original packaging should be returned to pharmacy. This can be done by returning the medication to the external return bin. To access the bin, select the patient, select Return Meds, and then select the medication which you'd like to return. Here I'm returning Tylenol, 1 tab, select OK, hit the Return Now button, and the external return bin will unlock. Open the bin, drop the medication into the bin, and close the lid. Once you're done, you'll have to enter a reason for return. You can select from the list or type in your own. Hit OK once you're done, and the bin will lock back up. In some areas, virtual kits will be programmed into the system. These kits allow users to remove medications quicker. In our system, we have a virtual training kit set up. To remove the kit, I select the patient, select Remove Kits, and then select the name of the kit I'm looking for. This virtual training kit includes respiratory medications, ipratropium, and salbutamol. If I'm ready to remove these meds, I simply hit Remove Now, and I'm directed to the medications. I can open the drawer, take out my first medication, close the drawer, and when I'm directed to the next drawer, reach in for my next medication. So as you can see, this kit allowed me to pull 2 medications very quickly without having to input the selection myself. You can still adjust the quantities that you want to remove from a kit when you're in there. So again, if you go to Remove Kits and select the kit and see the listed items, if you select the item itself, you'll be able to adjust the amounts as needed. We've now reviewed all the functions you'll need to use the Omnicell automated dispensing cabinet. If you ever run into issues with the system, please contact pharmacy and approach a super user in your area. Pharmacy numbers are attached to the business card located on your Omnicell. The card on the system will show the pharmacy number, the name of the cabinet, as well as the serial number of the cabinet. This information will need to be provided to pharmacy when calling.